you want to make sure that if your patient does have multiple sclerosis, or if you have multiple sclerosis, that you have your vitamin D levels checked and that you are at a good normal level for your vitamin D.
Today, we're talking all about multiple sclerosis with board-certified neurologist Dr. Kimberly Hatchett. The first question I'd like to ask about this is, why do some people get multiple sclerosis? Is it hereditary, or what are the risk factors for getting it?
That is a question that I think if I had the answer to it, I would be making a lot of money. But we know that some people are more susceptible to getting it. And what's interesting is that they find the further you're away from the equator, like the actual Earth equator, the higher your risk of getting multiple sclerosis, right? Women get it more than men. It's an autoimmune disease. And so it's theorized that a virus, you have some random virus, all of us get colds or whatever, and that virus, your body makes an antibody against it. And then that antibody will look around and see your myelin and think, oh, that might be that virus as well, and start attacking your myelin. So it's theorized that it could be some type of virus that you had, that your body, it was a trigger that caused an autoimmune reaction. Could it be genetic? Well, I think that some patients absolutely have a family history of autoimmune disease. So they're more likely to have some type of autoimmune thing happen in their lifetime, but not necessarily multiple sclerosis. But yeah, so that's the theory about multiple sclerosis as to why it's happening.
So that's really interesting about the equator. Why are people who live closer to the equator less likely to get multiple sclerosis?
So the theory is that people who live further away, live in colder regions, actually have more exposure to viral illness, it's interesting because we go through all these different seasons. People who live near the equator go through a season. It's always hot. So we go through all these different seasons. I say we because I live far away from the equator, in the Midwest, and that we're just exposed to more seasons and exposed to more chances of getting viral illnesses.
Is there anything that patients, especially patients that maybe already have an autoimmune disorder, especially women that already have an autoimmune disorder, is there anything that patients can do to lower their risk of going on to develop multiple sclerosis?
Well, I said that about viral illness, but also vitamin D, right? That is one thing that those of us who live away from the equator are a lot of us are walking around vitamin D deficient, because we don't get as much sunlight. And so that's another theory as to why multiple sclerosis can happen, is because of vitamin D deficiency. So making sure that your vitamin D levels are at a good clip or a good level is really important. And it can be a good preventative measure. So much so that if I'm seeing a patient for, headaches or for memory or for any of those things that are more vague neurological conditions or symptoms, I will check their vitamin D levels. A lot of primary care physicians check vitamin D levels just to make sure that people have their vitamin D. And then the sun exposure, because we know that we need to have at least 10 minutes of sun exposure to activate those vitamin D and to make the active form of vitamin D. That's something else that we try to give our patients to do.
So it's not just about supplementation. You still need sunlight.
Yes, absolutely, to activate it.
And is there a role for treating MS? Like, does vitamin D have a role in treating MS once it's already kind of been diagnosed for a patient?
It has a role in making sure that it's in check. So you want to make sure that if your patient does have multiple sclerosis, or if you have multiple sclerosis, that you have your vitamin D levels checked and that you are at a good normal level for your vitamin D.
So I think a lot of people don't know that there's actually many different types of MS. And could you sort of go over some of the more common ones and how they really differ in their treatment approaches?
Sure. The most common type of multiple sclerosis is relapsing and remitting multiple sclerosis. So those are patients that will have a symptom of, like, their arm will go weak, and that lasts for maybe a month, and then it gets better, and then they'll get foot drop, and then that will come and then get better. So it's kind of like if you look at their normal function on a graph, their normal function will go along and then they'll give a drop because they have a loss of function, and then it'll go back to their baseline. So that's the relapsing and remitting type, the most common type. Then you have secondary progressive. So these are patients that are going along a clip and they get a symptom and they go down, but they don't get regain of that function. And they keep going along and they get a little bit worse. And they might come back a little bit, but they never get back to their regular baseline. Then you have people who are primary progressive. That's the rarest kind, and that's probably the worst kind. And you think about people like Richard Pryor. Richard Pryor had primary progressive, the comedian. And it's just like a slump. They just keep getting worse and worse and worse. So there's also there's the third type of multiple sclerosis is primary progressive, and that's the worst type. And that's where patients will start to get symptoms and they progressively get worse and worse and worse, and they never make it back to their baseline. There's different medications out there. There's injectable medications. And so normally we start patients on those. There's also pills that people can take on a daily basis to prevent them. And there's more like chemotherapy type medications for the more serious type of multiple sclerosis. All of those medicines from a common standpoint are immune modulating. They modulate your immune system and how your immune system reacts to the antibody that's trying to attack your myelin.
And Dr. Hatchett, where can people find you on social media if they want to learn more about you?
Sure. So I am on Instagram. I'm under Dr. Kim Neurodoc. You can also find me on my website, drkimberlyjhatchett.com. And I have a newsletter called The Bluff. It stands for the bottom line up front. And there's links on Instagram and on my website to sign up for the newsletter.